What we do know about the BA.2 variant, which I think is important context for people, is that it's circulated in the United States for some time. We've been watching it closely, of course. We currently have about 35,000 cases in this country. We expect some fluctuation, especially at this relatively low level, and certainly that to increase. I would also note that while BA.2 is a more transmissible version of Omicron, the tools we have, including mRNA vaccines, therapeutics, and tests, are all effective tools against the virus. And we know because it's been in the country. And so as we're watching, and I think a lot of the reporting has been about, of course, the UK, but also China. And China has a zero tolerance policy, as you all know, but they also did not conduct their vaccination and booster campaigns with mRNA vaccines. So that is important context, too, as you're seeing the impact. What I would note, just to go back to your earlier part of your question, is that we are still pressing. The place where it is concerning is the fact that we need additional COVID funding. And we have talked about this. We talked about this a little bit in the past, but last week, all running together. But without COVID response resources and additional money, there could be immediate impacts on testing capacity. The uninsured fund, which offers coverage of testing and treatments for tens of millions of Americans who lack health insurance, and on our supply of monoclonal antibodies. And that means that some programs, if we don't get funding, could abruptly end or need to be pared back. And that could impact how we are able to respond to any variant, of course.